name is Gillian Harman. I'm a tissue viability nurse specialist, and I'm the service lead for tissue viability, the leg ulcer service and the lymphedema service. I work for Bromley Healthcare. We're a community organisation providing services to South East London. Geographically, we're the largest London borough with a population just shy of 330,000 people. So our aims for being involved in this project is we wanted to improve and streamline the care for patients that are presenting with a lower limb wound and support the ongoing implementation of the National Wounds Care Strategy Lower Limb Pathway. So there have been quite a few challenges on our journey, and I think for me, sometimes what you think is going to be a quick win takes a lot longer than what you think. But I think really I would have to say that the biggest challenges has been around the data and having a system in place that collects the data that we want to collect and that is fit for purpose, which is generally a challenge in wound care. But also making that data meaningful and understanding what it is telling us, and then being able to use that data to influence change. A year on, the project has just gone so quickly, and I think now we're only beginning to realise what the data is telling us and being able to fine-tune that and use that to improve practice. I think our most significant success has been that we are now able to produce data, and there's that saying you can't see the wood for the trees, and then to be able to influence change and make positive progress. If you can't see the wood for the trees, that's a bit difficult to do. And that we've been able to trial a digital solution in the way of a wound app to be able to make that data more visible to us and more meaningful, and ultimately that will then support us to be able to improve care. I did give this some thought what I would do differently, and I think what I would probably do differently is widen the scope of our core group earlier. I think we've brought people along on the journey with us, but those champions are absolutely essential, and communication is so important. And when we're out working with community nursing, sometimes they don't know the background to what we've been doing. So I think to maybe have brought them onto the journey earlier and really get those champions embedded right from the word go, which we have had, but I think to bring them along in the core group might have influenced that better. I have to say that the tools and support from the HIN have been absolutely essential and hugely beneficial for this project. I think that space that we've been given, having that space to come together, to regroup, to refresh and reflect, feedback and share practice with each other have really helped to drive the project forward. It really has been an incredible journey, but as the way the models go, I love the logic model. Yes, the logic model. I think in a project like this, it can be quite overwhelming. And for me, thoughts can get quite jumbled. There's such a lot going on in day-to-day practice, and the logic model for me really helped me to realise my vision and to be able to reset my thoughts and realise where I am and the journey that I'm going on and how we're going to get there. I think we were going to continue to embed good practice and continue to build on where we are. I don't think it's something that we can step away from. So we will continue to be supporting out there in clinical practice. But next for us will be to reach out further into primary care and to start to use the journey that we've been on to take that further with our primary care colleagues. So my 3 top tips for this journey, this took a little bit of thinking to just get them down into 3, would be to talk to people. This is not a journey for one person. You need a support network around you and as many people involved as possible. Be kind to yourself. Things take time and change is a continual progress, and use the logic model.